How many of you here tonight have ever met someone with autism? Basically all of you. For those of you that didn't put your hand up, this is Jack. Jack is part of the nearly 1% of all Australians diagnosed with autism spectrum disorder. Autism spectrum disorder, or ASD, is the broad term for a range of developmental disorders that result in social and behavioural issues in children. Now, Jack, what he's doing here is something called stimming, which is a really, really stereotypical sign of autism. But being on a spectrum, it can range in severely autistic people as aggression, the inability to use spoken language, or the complete inability to socialise, generally with people outside of one's family, and can range to mildly autistic individuals that might just seem a little bit socially awkward and sensitive to the environment around them. In other words, as I've always been told, we're all a little on the spectrum. Despite this being a fairly common disorder, we're not actually too sure why some people are autistic and other people aren't. The answer to this question almost certainly has a genetic component, and there's been studies that have been done that have shown where one child in a family has autism, the chance of their siblings having autism increases. And this makes sense, right? I share more genetics with my sister than I do with any of you. But another thing that siblings often share from a very young age is their environment. And this can affect something called their gut microbiome. All of you in this room have trillions of bacteria living and dividing inside your gut. And this is known as your gut microbiome. Makes you feel good, doesn't it? Now, there are some really common bacteria that will be present in almost everyone's gut microbiome. However, the exact composition of your gut microbiome is completely unique to you. And this is largely established in your first months to years of life. While it does change slightly over your lifetime, your diet as a child, the environment and bacteria that you're exposed to, and even the delivery at birth, all have a massive impact on establishing the sort of microbiome that you will have for your entire life. Now, the primary role of your gut microbiome is to digest certain types of food that you eat. However, it also has been shown to have an influence on your emotions and your behaviour. Now, some individuals with ASD have an abnormal gut microbiome, meaning they have higher or lower concentrations of certain bacteria compared to non-autistic individuals like you or I. And this is thought to influence the severity of their symptoms. As a result of this knowledge, fecal microbial transplants have been proposed as a novel treatment to this issue. This involves taking a fecal sample from a donor and introducing it into the gut of a patient via an enema-like procedure, which, trust me, is the nicest way I can put that. The goal here is basically to replace the bacteria in the gut of the autistic individual with the microbiome of a non-autistic donor. And while this idea might smell a bit off, thank you. It's actually been shown to be effective in treating some disorders such as chronic fatigue syndrome, Parkinson's disease, and even ASD when used in conjunction with antibiotics. And the best thing is, it's cheap. Right? The donor is often a family member to avoid things like infections and adverse side effects, and the whole procedure can be performed at home. But if you thought getting your kids to take their medicine now was an issue, it's just next level. Now look, by no means are we going to see individuals treated with this tomorrow. There needs to be more rigorous clinical trials and research into the strength of this gut-brain link. But we spend $11.2 billion every year on autism in Australia. If we could implement this solution into Australia and reduce the number of patients with autism, or even just the severity of their symptoms, we could save billions every year in the funding of special schools, carer costs, and the funding of early intervention, which is the current mainstay of treatment in this country. But more than that, this treatment could mean the difference between a child being able to make friends, or attend a normal school, or just live a normal life. And that's not something we should just flush away. Thanks.